Hey, it's your favorite therapist, Tiff, and we're going to go ahead and study treatment planning. Here's my disclaimer. Just because you study with me on YouTube does not guarantee that you will pass your exam. However, I highly recommend that you study, study, study. And if you don't know what to study or how to study, watch my previous videos where I talk about techniques, materials, and resources to help you pass. This is what I did to pass my exam on the first attempt. I passed my NCE on the first attempt, and I passed my NCMHCE on the first attempt. Reason why is because I took the time out my day to study. Each person is different, each person learns differently, and you have to know what works for you. If you still have questions or need more resources, I do have some available. You can go ahead and email me at sparkle_0883 at Yahoo, and I can help you out there. All that I ask is, if you want me to continue to make these videos, is that you subscribe, like, comment to help me continue to do the work and for me to know what you need. Okay, now I'm not gatekeeping over here. I never gatekeep. I share all the information that I have to help you become a better clinician. So let's go ahead and get started. We're going to use the same technique that we have used in our previous videos. Each slide will sit here for about 2 to 3 minutes, and then after the slide with the question it pops up, then you'll have the slide with the answer, and then I will explain to you why we chose that answer. Let's go ahead and get started. 45-year-old male with major depressive disorder reports difficulty in maintaining employment due to chronic low energy, feelings of worthlessness, and concentration problems. What should the initial focus of treatment? A. Develop a vocational training plan. B. Address cognitive distortions and self-esteem issues. C. Encourage immediate return to work. D. Focus on sleep hygiene and physical health. The correct answer is B. Address cognitive distortions and self-esteem issues. So how do we know this is the correct answer? Well, we need to know a little bit about the diagnosis, which is major depressive disorder. And so typically with MDD, therapists will use cognitive behavior therapy. And if you know anything about cognitive behavior therapy, it is known to address cognitive distortions, which are common in individuals who are diagnosed with major depressive disorder. By focusing on alternating negative thought patterns and improving self-esteem, the treatment will alleviate symptoms of depression, which is why your client is here. And while vocational training may make sense, physical health is very important. Addressing the cognitive issues is what's crucial for this client because the client's well-being is based on their inability to maintain employment. A client with general anxiety disorder reports frequent panic attacks and difficulty maintaining daily stressors. What is the therapeutic intervention that is most appropriate to address the client's symptom? A. Cognitive behavior therapy, CBT, focusing on catastrophic thinking. B. Long-term psychodynamic therapy. C. Psychoeducation on the benefits of medication. Or D. Exposure therapy to address the panic attacks. The correct answer is A, cognitive behavior therapy focusing on catastrophic thinking. And we just talked about CBT. So, CBT, if you don't know a lot about CBT, CBT really just helps on reframing thoughts. I love CBT, it's one of my favorite modalities. And so, when we think about this client, if you can reframe their thinking pattern, you can decrease their anxiety and panic attack. And so, typically, CBT is used to help clients identify and challenge their irrational thoughts, which, like I stated, will reduce anxiety and it will improve coping skills and strategies. And long term psychodynamic therapy doesn't help because it only provides immediate relief. And psychoeducation is great, which it is kind of a part of CBT. And exposure therapy, they could be great options, but if we did the red light, green light, yellow light situation, the best option would be CBT. CBT would be the green light, and psychoeducation and exposure therapy will be yellow lights because they are options to utilize, but they're just not the best option for this client. A 30-year-old woman with PTSD from a recent car accident is unable to drive and has flashback when seeing cars. What is the best initial treatment approach? Initial, okay, I'm heightening initial. A, begin in-depth trauma processing immediately. B, gradual exposure therapy to driving situations. C, encourage avoidance of driving situations until she feels ready. Or D, focus on teaching relaxation techniques to manage flashbacks. The correct answer is B, gradual exposure therapy to driving situations. Now, if you're asking why isn't D the best option, and I'm going to explain D to you before I explain the answer because I know a lot of people would have chosen D, okay? So, while focusing on teaching relaxation techniques is amazing and it helps with reducing symptoms of anxiety and stress, including the flashbacks, but it doesn't directly link to the avoidance behavior that accompanies the PTSD. So when you are reading these questions and you're trying to figure out what is the best option, what is the green light, you have to make sure that you're addressing what they are telling you within that scenario, okay? And so in this one, it says she's unable to drive, which means she's not able to complete the task, right? Which is like, we can look at it as avoidance. So if you thought about PTSD, you will have to think about avoidance versus confrontation because that's typically what takes place with PTSD. And so avoidance can help the cycle of anxiety heighten, and it limits the client's function, and it doesn't decrease the goal within the therapeutic setting. So if you're encouraging them to avoid something, then you are not helping them actually address the trauma. And although you will teach technique, relaxation technique, because that is something that will take place within the process, um, that is like a component of it. Gradual exposure is is really ideal because it helps them confront their fears in a controlled manner, so they are in control of how this impacts them, and this approach reduces avoidant behaviors and anxiety over time. A client with bipolar 2 disorder reports frequent mood swings and difficulty adhering to their medication regimen. What should the treatment plan include as a priority? A. Psychoeducation on the importance of medication. B. Exploring deep-seated childhood issues. C. Engaging in weekly group therapy for social support. D. Immediate referral for ECT. The correct answer is A. Psychoeducation on the importance of medication. When we think about the diagnosis of bipolar 2, it is really important for clients to have self awareness, especially when it comes to their cycles and how it impacts them in their body. So, by providing that education about the medication, is going to help because a lot of times what happens is that, and I'm laughing because um, I know I do this when it comes to like things. When things go great in the world, when things are moving smoothly, you kind of forget about all those other tasks that you put in to help you continue to move that way. So for instance, like for an example for me, I have to follow my schedule every day, and my schedule goes well. My day goes so well when I follow my schedule. And then one day I might say to myself, okay, I'm not gonna follow my schedule because my days have been going well. So I don't need to get up at the house at 8 o'clock every day. I can leave it at 8:15 because things have been going great for me for so long. Because I was following my schedule, and then this one day I decide not to follow the schedule, and then this day goes horrible. And that's kind of what happened with the medication is that individuals who take medication, they're like, okay, well, I've been doing great because I've been taking this medication. And then the one day they decide, okay, well, I'm not going to take medication because I've been doing so great. well, that's the day they really need it, or it starts to follow and fumble on them. So it's really important to just give them that psychoeducation, and that's why that's the correct answer. A client with social anxiety disorder is highly motivated to overcome their fear of public speaking, which is impacting their job performance. What is the most appropriate therapeutic intervention? A. Cognitive behavior therapy with exposure experiences. B. Psychodynamic therapy to explore childhood experiences. C. Hypnosis to reduce anxiety. D. Group therapy focused on social skills. The correct answer is A, cognitive behavior therapy with exposure exercises. So I know you've been hearing CBT throughout this whole session that we had today, and that's okay. CBT is actually one of the most popular evidence-based techniques, and it really does work. It's one of my favorites. I use CBT, I use TFCBT. CBT is one of my favorites um if you are a believer that thinking patterns impact behavior. I know some people who are like behavioralists, which I mean honestly, if you're behavioralist, you kind of do agree with CBT, but is that what makes behavioralists different from individuals who believe in CBT is that cognition where a lot of behavioralists just kind of think it's like, oh, it's behavior. But anyway, CBT is great with exposure exercises, especially for social anxiety. And the reason why is it because it helps clients confront and reduce their fears of public speaking for this situation. Um, and it creates a safety for them to desensitize themselves when it comes to certain behaviors such as that. And while psychodynamic therapy might be beneficial, it's not the most effective when it comes to anxiety reduction for performances or being in front of a person or being in front of people. So those so B and C will actually be yellows, and we talked about that. D will also be a yellow too. So here we really don't have a red, because group therapy definitely helps with social anxiety too, because people are interacting with one another. But remember, when you are answering these questions for these tests, it is only one answer. So the format has changed. It's not the old format where you can choose different options and then add up to points or it reduces points. That's not what we're doing here. You only get to choose one answer, and when you're choosing that one answer, you have to choose the best answer. So if you watch my other videos, you will know that this is your green light answer. And how do you decipher between a green light and a yellow light? Number one, it should hit every single component of what is being presented to you with the scenario, okay? So that's one way you know. Like, let's pretend you have an answer, but it's only parts of the answer, or it only gives you some relief. Then you automatically know that it's not a green light because it's not hitting on every single thing that needs to be addressed. So we are done for today. I'm going to upload another video for you guys. If you have any questions or comments, go ahead and put it down below. I really appreciate you for being here and subscribing and liking the channel. And I'd like to see you next time.